Hi, my name is Shaidrova. I'm a CEO of OPORA, and today I will tell you about one of the biggest programs that I happen to author, actually. It's an Empatia Program. It's a program that focuses on access to mental health for displaced people. But after 3 years of working in this program, we realized that it goes way beyond that. So this is exactly what we are going to talk about. And I'm joined by the program manager of this program, Anna-Mariia Sukhar.
Hi, pleasure to be here.
4 years ago, the big-scale invasion in Ukraine by Russia started, and at that time we expected that there will be a lot of refugees. The number of refugees crossing the borders was really unthinkable at that moment. And of course, one of the things that we expected that after the traumatic event, people will feel stress and they will feel consequences of this event. But what we also expected is that it will not reveal itself right away. It was 3 months after the war started that we started noticing in the community that people were asking psychological help. Mostly it was connected back then with grieving, if somebody died in their families and something very shocking, but people have not yet at that time processed the trauma. So yeah, it was not something prominent in their requests to us. We were at that time a group of volunteers. Everyone had their own jobs. But since we would like to anticipate problems, we decided to look at how Ukrainians in 2014-15, when we also had mass displacement within the country, we wanted to understand, okay, how did these people live through their traumatic experiences? And we found out that, of course, it didn't start right away. It started when people were a bit calm, when they found a new home, some kind of first level of stability. And the second, that people were not really asking for help. So they were actually asking for everything else, like social help, money, housing, but not psychological help. At some point, we also noticed more and more Ukrainian psychologists talking online and social media about the fact how people feel, how people in their shelters feel, because suddenly they were also displaced themselves, and also how much they try to support people on the ground. And after 4 months, we decided to open this line where we tried to connect Ukrainian psychologists with the requests of people. It was in April 2022. Suddenly we had up to 200, 300 requests, which was quite a lot at that time. So we thought that, okay, that means that people already kind of processed the first level and they are now entering in a time when they do feel the consequences of what happened to them. And we also knew that only 10% of people will have really PTSD or serious trauma. So we knew that this will not affect everybody, but a lot of people still struggled. And of course, when you struggle, you start asking for help. And when there is a psychologist or somebody who knows how to speak to the other person or offering a listening ear. But from our side, we felt, okay, this is quite a big responsibility. And I think we need to find somehow a structural solution to the problem. For that, we decided to do research. Back then, it was focused on women and children. The idea of the research was pretty much to understand how children were feeling and how their parents also could assess their psychological health, but also self-report their own problems. And we knew Ukrainians didn't like to talk about their problems, so we tried to copy the methodology that was used for IDPs and see how not to ask directly about psychological problems. Instead, try to ask about how they feel, what kind of level of stress they have, do they feel anxiety? And of course it worked, and we started seeing that anxiety and a lot of other symptoms were self-reported symptoms were quite high. And that also showed us that, okay, people actually do feel bad and they need the support. But when we asked them about how would you need the support of psychologists or how would you rate your psychological health overall, the answers were, it was fine. But when we asked about anxiety and about stress and about trouble sleeping and trouble concentrating, it was really high. And that also confirmed what we were already thinking back then. Meanwhile, we decided to gather the database of our psychologists that we were interacting with when we had this kind of emergency support line. And with this data of the backgrounds of psychologists, with the requests of people and analysis of this request, analysis of the literature, and quite a good research that we did, we had at that time 700 respondents, and there were only 11,000 people in the Netherlands. So I think that was quite a representative sample. And I think that all together helped us to actually think of Empatia as a structural solution. And what is also interesting is that you asked me about why mental health, because I think that this was something that we knew Ukrainians would not ask for help. So you needed to find a way to bring them to this help and actually find such a solution that would both be structural, so be kind of embedded, address their fears and stigma when it's connected to mental health, but also actually provide some kind of, like low-level access But of course, the problem was that the Dutch system was quite overwhelmed already, and we calculated that even 10% of those who really need help, I think that they would not be able to get this help. We also knew that the housing and other issues were taken care of by the government, but of course this is something that is not so straightforward, and people here didn't know the culture or stigma associated with mental health in Ukraine. So what we did, we were thinking, how can we kind of tackle everything? So how we can make sure that people come and ask for help, how to make help structural, how to make sure that Ukrainian psychologists can work in the mental health sector here, and also how the Dutch health providers could actually feel courageous enough to hire somebody under their registratie, or what they say actually under their supervision. And I think that was the question. And we thought it would be nice to provide the answer. But of course, the matching psychologists with institutions didn't answer the questions whether Ukrainians will actually go there and be a client. So you needed to have a matching center that would help psychologists to find a job. At the same time, you needed Ukrainians to know how to go to the GP, which was also not an easy thing. So it's difficult to talk about your psychological problems overall, and suddenly you have to talk about psychological problems on the language that you don't understand. I think that was quite a tough thing. And the only way for us and for GGZ to get clients is pretty much for the people to be referred by the GP. So if they don't go to GP, then of course these clinics will not get clients. And if they don't get clients, what will happen is that no matter how good psychologists they hire or whether they hired psychologists, they will actually not be able to sustain that hire. And then you also had the problem with Ukrainians who just didn't know how the system works. So what we decided to do, we decided to open a matching center that would allow basically psychologists to get support and actually be hired. But we also thought about how to reach out to Ukrainian community and teach them. And we did the research on what are the means that Ukrainians ask for help with. And I think Helpline was one of them, especially for generation 25 plus, pretty much. And we also found out that in 2022, numbers of requests in different kinds of hotlines, not only psychological helplines, are skyrocketing too. So people were calling somehow when they were distressed. So we decided to do a helpline.
And at the same time, also not only waiting for Ukrainians to reach to Helpline themselves, but also reaching them out proactively. So for instance, MHA's service was designed in a way that a group of psychologists could come to locations and provide educational trainings on various topics so that the people can also kind of have a lower entry point to better understand their emotions, regulate how they feel, and learn more about how normal it is to feel yourself like this in this completely unnormal situation. Our matching center was designed to gather a pool of professional psychologists who have been themselves displaced to the Netherlands and want to continue working, and actually building the integration pathway for them to be embedded within the Dutch mental health system and provide help for Ukrainians. This is again a situation when people cannot fall into professional limbo while also providing help in the native language for those who do not speak yet the language but need professional help immediately. However, the matching, I am always very excited to talk about this because the matching within the years has developed itself not just to the system where we have a pool of psychologists. You come, we advise the psychologist who would best fit the profile that you are looking for as for organization. But it actually turned into the whole ecosystem of a network of professionals who also develop themselves professionally, who build connections and support each other. And we provide also an infrastructure for this by providing them trainings and knowledge exchanges from Dutch professionals, by providing intervention sessions, by providing supervision sessions. And what important is that we match psychologists not only to GGZ institutions, to professionalized psychological help, but also to municipalities, so to provide psychosocial support. And those psychologists who are providing this psychosocial support for people on locations, they are not obliged to take supervision sessions. However, being committed to the quality of care that they are providing, we cover these supervision sessions for them so that we can also ensure that they do not burn out themselves.
Yeah, I think that it's also what Empatia is pretty much now, is this kind of, I call it Empatia circle, so where you have matching center, you have support for psychologists, supervision, intervention, you have a helpline, and you have the group that works with all of it and tries to do it proactive engagement, but not only with Ukrainians, but also with healthcare providers, and helping them to understand, okay, why it is difficult. And of course, we are talking about now the first year. Now Anna-Mariia will tell about other 2 years of Empatia's existence. In the beginning, this is how it was, and we got support from a lot of organizations, Vluchtelingenwerk, GZ Netherlands at that time. So it wasn't just initiative of OPORA, it was also, I would say, there were a lot of partners and parties that supported us, including back then Ministry of Justice. So I think it was quite a unique opportunity. Yet, of course, in 2022, it was still a pilot. We were still wondering whether it will work, what our ideas, research, solution could actually be applicable in everyday life, and also, of course, in this system. And as for the name Empatia, well, I think it came from one of our employees in the first year of Empatia. And together we were brainstorming, okay, what would be the best name? And I think somehow Empatia came very naturally, because I think it's something that people can pretty much associate with. It is something that for sure people were lacking when they're living in the other country. I think it's something very basic and seems like everybody knows what it is, but when you're suddenly outside your bubble and your friends and your family, I think that this is something that you feel you need the most, just simple empathy. And I think that that's a bit how Empatia came to be when it comes to a name.
I think it's really about trust, and how we wanted to show with open heart to people that the solution Empatia can bring to them, like getting access to mental health help, is there for them, and that they have this, like, something to rely on in their lives, and just call a helpline and feel that they can be heard, even when sometimes it may be difficult to explain what are you facing. At least what we can do is have this listening ear and empathize you about the situation you have. So a lot of times we also started like with enthusiasm, not having clear solutions on the table or not knowing how to navigate, but our eagerness and openness to let people know that they are not alone. I think that's also really embedded into the core of Empatia Program and reflected in its name.
Yeah, and I think that from the point of view of administration, I think Empatia is quite unique because it is quite complex, so it targets so many different audiences. So we work a lot with those who provide help, and I think it helps us to understand very well how the system works and how fragmented the mental health support is in the Netherlands. But at the same time, it also gives hope to people because they know how to orient themselves in that market. And I think from that perspective, I think it's quite a unique program, but at the same time, it could definitely serve as a blueprint for a lot of other things. But we try to always develop, and we can use data or we use a lot of things we learn from this pilot to actually make an improvement or develop more interesting programs, or try to see who is actually outside the support system and whom we can actually bring forward and make sure that everybody who needs has an access to the help they require.
In Empatia, we constantly try to improve, and that's what I actually clearly remember from my first interview when I was just joining OPORA and was first months of Empatia. I was joining in a department, and I was really impressed with that idea that we do not just want to have a model developed back then and then to multiply it, but we actually have embedded M&E structure, which is monitoring and evaluation of our activities and the needs of people, to see whether our response is the best one that people need at the time. So yeah, that was really echoing in my mind, in my heart, and I am happy that this is the approach that how we started actually, but also the approach that we kept and that helps us to grow threefold. So starting with Empatia 4, You can actually barely recognize the services that we started with. I mean, the core, of course, is there, but the approach, the mindset, or like the trainings, how they evolved, and the level of also involvement and expertise of different partners, of people around that we also include in our program is tremendous, I would say. We have a helpline that Maria mentioned, we have MHA services, and we have matching center, and we have M&E department that gathers the data that we produce on each day. So people, stakeholders call helpline, we understand what is happening on the ground. We match psychologists, and we have the access to the field to understand what is going on. We also have that information exchange, and then we have an idea. We pilot it, then monitoring and evaluation gathers data. We gather together in those so-called innovation sessions every month, actually, to exchange their ideas and to see how do people respond to our services and products. And then we iterate. For instance, how our services evolved thanks to this model is that for Helpline, it was during Empatia first year pretty informational, but then we understood that in order for people to really get help to open the doors, it cannot be solved just with one phone. So they need to be triaged correctly, they need to get proper information. Sometimes we can refer them to GP, but they cannot simply go because of the language barrier, or because this elderly person does not know how to go and to register with the GP practice. So our help does not end on a phone call, but this is the support, so we can basically help person navigate through the system to open all the doors, not to fall into the cracks of the system. MHA services are mental health advisory services that are aimed to give this low-level support to people by reaching out to them. This is, in the Netherlands, this is possible because most of people have been taken to shelters, that they live on locations, and knowing the location, getting in touch with location manager, you can actually get access to people. But MHA services, they are not only aimed on UDPs themselves, but also they are created for location managers. What we see is that actually the ability of people to navigate through the system is also highly dependent on the help they receive from location managers. So having a good understanding from the Dutch perspective of Ukrainians, what they are going through, what kind of needs they have, was important. And that's how culturally sensitive training was introduced within MHA services, besides all the products that we produce also for Ukrainian displaced people and support groups. Then during Empatia 3 year, we have noticed that after this long displacement, after this accumulated stress, people are also facing conflicts on locations. And that's how Empatia responds, actually. We see that the new needs are emerging, and then we try to get it covered. Yeah, a good example for that would be that we asked a legal trainer to join our basic Empatia services and to introduce some regulation techniques on conflict management. So we are trying to address this issue through equipping people to understand how they can manage the conflicts, how to get out of conflicts, how to prevent conflicts, but also explain location managers why people have conflict. This is, for instance, an example of how we adapt, how we iterate, and how we respond.
Or we do it through, for example, by partnerships also. For example, looking for, when we got more cases of sexual violence and exploitation and assault, we started looking for Dutch partners who actually already can provide services, but we found out that there is a lack of translation, or there is a lack of overall trauma for translators. And when people want to talk about the most intimate problems, it's very difficult to talk about when somebody cannot translate properly. Or, for example, what we also see more and more is that it's not only about helping to people. So we use these proactive services pretty much to help displaced people to reach out to help, basically to go to GV and actually be referred to. That's why we also created interactive map that we update all the time. But we also realized that we need to help locations with how they organize their own location. So what can be the ways, more psychosocial, but also overall almost architectural urban solutions that can help people to organize their spaces better for people. And for that, our mental health advisory team, they conduct for every shelter visit that they go, they conduct an assessment. So they actually ask both people, location managers, and they see what kind of conditions people are in. Because we also realize that a lot of stress that people experience come from the conditions and from the situations or from the way how they are treated.
The idea of Empatia and its challenge that it was never just about adding more services. But the real challenge was to make the access possible for the system and the reality that was not designed for it.
Yeah, exactly. And I think that overall there's deadlines that are in the mental health services because of the lines that we know are in the Netherlands when it comes to psychological help. We know that people cannot get help right away. So of course, Empatia was by design, was the place where we tried to respond to that. But we also learned many things along the way. And we, for example, now we know how to organize this kind of help and how to react quickly and what people need when it comes to extreme stress event. And we know that the way of thinking behind Empatia could be applied to very many groups and many situations. For example, one of the things that we thought was quite innovative for us is that we realized that, okay, if the mental health system is quite fragmented, or I would say mental health system is not so fragmented, but the reception of people in municipalities is quite fragmented. So people are spread all over the country. How to help them the best? And we do believe that the regional or local support sometimes is the best, because local support means community. Local support means that you can organize the access to health for the particular group on the ground. And this is a bit how we started thinking about regionalization, we call it, or approaching the problem of access to mental health on the regions. And more we worked in the regions, more we realized that the problems Ukrainians faced or refugees face are not unique. So a lot of people in that region face the same problems. And a lot of people just don't know how to help, and a lot of organizations don't work in partnerships to be able to help. So I think that that's a bit how we started moving towards more regional approach, but also towards stakeholder management and kind of make sure that stakeholders that are already there know and are aware of the problems of people and can actually provide a response much more efficiently. While on the national level, we can still think of the products or think of solutions, which can be specific programs for teenagers. It could be programs for addiction. It could be something that should be somehow addressed nationally, but a lot of other things could still be addressed locally. So I think that this is something we are also moving towards, and this is not something we knew when we started Empatia, actually.
This is not something that we designed in Empatia, this regional approach, but I really like how it reveals itself and how it shows that each region has its own ecosystem. And coming into the region with our needs assessment for Ukrainian displaced people, but also having dialogues with stakeholders and understanding deeper how do they organize the help for themselves, can actually show and highlight this regional uniqueness, which cannot be always obvious to the region itself. So like distant locations or very like fragmented response to how the locations are organized. Some could be like old office buildings, while others like small cottages for families. And you always have to think how this infrastructure actually influences people possibilities. So we already actually saw that we did 3 regions during Empatia 3, like this understanding on how they are unique, and we saw how different they are. So for those that are more urbanized, the problems can be very different than for those that are located in more rural areas.
We also learned on how much you need to do on a local level and how much on a government level in this way. So we also see, for example, if there are people with addictions, we don't have enough addiction clinics in the Netherlands. So of course the prevention should be done on a local level, but the treatment itself sometimes has to be done on the national level, as well as access, for example, specialized help for teenagers or for young children. In the Netherlands, it all very depends on the municipality and what kind of contract they have with which healthcare provider. And sometimes healthcare providers that they have a contract with doesn't really have enough specialists that would cover this specific issue. And of course, if you have children that don't speak the language or children that have very severe traumas that this clinic had no experience with or no specialist to deal with it, then the children very often actually don't get any help. So of course there is a level of community engagement, like how we can organize the reception. There is a level of psychosocial support, emotional support, but also, unfortunately, there is also a need of specialized care for some patients. And if you don't provide it, for example, on location, that in everyday life, we don't see that our neighbor is suffering because they close their door and that's it, that's their problem. Of course, they are suffering. But of course, if you live in a common space, you cannot close the door and all your breakdowns will be seen. You cannot hide psychosis, you cannot hide a lot of things. So I think everything becomes very visible. And it is the same as in the city when you have the whole apartment block and somebody suffers and you don't know. I think then the problems become more salient. And the same with migrants overall, or in the situations when there is a mass displacement, a lot of problems that were already there for a long time, they just become visible. Not that the new group brings new problems. Actually, these are the same problems, just new group makes them visible. And if it is visible, you cannot ignore them. And in everyday life, especially with mental health, a lot of people ignore their own problems and also their surroundings. It's because suddenly the problems become visible. And there is a lack of training and trauma support. I think in the Netherlands, we didn't deal with this kind of trauma of war for a long time. So of course, a lot of professionals are not trained in how to work with trauma. And moreover, a lot of people already come here with their traumas. And then the displacement overall accentuates the traumas, and it actually brings on the surface something that was there forever. And of course, that sometimes requires a lot of special care. And if you don't have people in the system, inside the system, all this psychosocial support is good. But if people who need it and who have certain diagnoses don't have care that they require, then the consequences can be quite fatal for people, but also for the surroundings. And I think that is also why in Empatia we tried to tackle both. And meanwhile, also use everything that you have gathered, all the data from the field, to be able to find out where there are more people that don't have access. And that's a bit what we are focusing on now. We try to see, okay, what are the needs, for example, of people who are kind of stuck between systems, like children who sometimes cannot get help from the municipality. And I think one of the programs that we developed in last year was Teen Resilience Academy, and Anna-Mariia can tell more about that.
Yeah, Teens Resilience Academy was developed as an idea that resilience in adolescence is not built in isolation. So it's not only targeting a teenager or like a group of teenagers, as we also do this in the group, but it also targets the environment. So in order for a teenager to become more resilient, you also have to work with parents. You have to work with these stable systems that are surrounding teenagers, which is also usually school, teachers, classmates. And this is how we developed the program to actually ensure that the teenager can not only get an idea how to regulate the emotions, how to navigate through how they feel, but also that the environment is responsive to their needs. So within this TRA Academy, what we also do, besides the workshop with teenagers, we also propose consultations for parents, for them to be better equipped how to talk with their child, how to establish this stable parent-child relationship, and also how schools can be more responsive to the needs of teenagers.
So it goes basically beyond just displaced teenagers, but what is the ambition of this program then?
Yeah, that we understand that this feeling of the stability of a child's environment, it became prominent within Ukrainian displaced community because children have been dragged out from their normal life, But this is not only true for this group. So as simple as children of expats or children of those whose family decided to relocate because of various reasons, they are having the same issues. So the program can be adapted to the needs of various groups of those who are placed in SKA classes, right? When teenagers are feeling that they had something stable, normal, and maybe they doing had a certain excellence rate in their previous school, and then they come to a known country, they cannot speak the language. They out of nowhere being placed in the class where they have to do what they only have to do is to learn Dutch language for 1 year. And then obviously they may feel various emotions, and how to cope with those emotions. This is exactly what TRA can be a solution for.
And also the idea of how Empatia works within this innovative structure, something that can be applicable to any country, but also to any group. So it's about the constant learning, what we in OPORA also approach through the concept of social innovation when we research, when we find a solution, when we pilot it and we test it. I think Empatia is a good example of it. So how we, from a research, we came to a certain solution, then we changed how we operate because the needs were changing of the population. And in the end, the goal is to increase the access both on local and national level, and also see who falls outside this access. It can be people who were suffering from sexual violence, or people who actually have addictions, or people who struggle with socialization, or like teenagers, or teenagers that are very tough. And also I think that what is beautiful is that we are not afraid of challenges. And I think looking at how our team operates, we have very various experts from different countries, but we managed to gather together and think about one big problem, which is access to mental health that goes beyond displaced Ukrainians. And we believe that our experience with this group will pretty much open the doors for so many others to get an access, especially if you look at it through the gaze of social innovations and evidence. So I think that our idea, and something that we want to work on more and more, is how to make sure that these people who are behind the scenes can be seen and access healthcare, but at the same time how we can make sure that the system, or the healthcare system overall, sees these people and make sure that they actually access the services designed for them and not only be left outside.
Yeah, I think this is a really big strength of Empatia, that we don't want just to embed the services within a new infrastructure, but actually put them into the system, introduce it into the system so that it strengthens. And then it's a win-win. Yeah, what we are observing more and more, that the cases within Empatia Helpline are becoming more complex. So the person can have a housing issue, some conflicts with people on locations, while also struggling mentally. And I don't know, maybe also like employment issues with their contract. So this is the reality. This is not one-off case. That's why it's very also difficult to address the problem of distress they might be facing, while not giving them tools or equip them with the knowledge how to solve the other things. Therefore, what we were observing, because we also have a legal helpline in OPORA, is that people in that distress wanting to tackle their legal things, they call legal helpline. But the level of anxiety, for instance, they might be going through is so big that it also keeps them away from resolving the things. Actually, the solution that we are bringing Empatia for is Helpline Merge. So meaning that people who will be calling helpline, they will have an opportunity to choose for legal services or for mental health services, but also the referral for these tough cases will be much easier due to the infrastructure that we are building.